There are several different disorders that are associated with joints. Some of the common joint injuries are cartilage tears due to compression or shear stress. Fragments may cause the joint to lock or bind, so they need to go in and remove those surgically. Thankfully, they can do that minimally invasively now. It's called arthroscopic surgery. So partial meniscus removal renders the joint less stable and more mobile. But the complete removal definitely leads to osteoarthritis, unfortunately, which is oftentimes associated with aging. Some younger patients could get a meniscal transplant, but and then hopefully maybe perhaps menisci can be grown as stem cells in the future. So here you can see a tear in the meniscus that has to be um, repaired surgically. So you actually can see on YouTube now some of those surgeries. They look pretty interesting to watch, but if you have a light stomach, maybe I probably would not recommend them. Other common joint injuries are sprains, where reinforced ligaments are stretched or torn. Maybe after a car accident, they could sometimes be identified initially with an x-ray. Common sites are ankle, knee, or the lumbar region of the back. Partial tears do repair very slowly because remember, cartilage is avascular, so it has a poor vascularization. So, three options if it's torn completely are that the ends of the ligaments can be sewn together, replaced with grafts, or just allow time and a mobilization for healing. When there is a dislocation, that is called a luxation. And this is when the bones are forced out of alignment. They're accompanied with sprains, inflammation, difficulty moving the joint, and they're caused by serious falls or contact sports. So they must be reduced to treat. If it's a partial dislocation, that's referred to as a subluxation. There's actually certain disorders where subluxations happen constantly for that poor person. Some inflammatory or degenerative diseases we've already kind of talked about now, but bursitis and tendonitis are very similar because they're inflammation of the bursa or the tendon sheath. The bursitis could be caused by a blow or friction, and it's usually treated with um, rest and ice and possibly anti-inflammatory medicines. The tendonitis is similar to bursitis because remember, both of them are synovial sacs. For arthritis, there are over 100 different types of inflammatory or degenerative diseases that damage joints. Most are widespread, very crippling disease in the US, and the symptoms are pain, stiffness, swelling of the joint, and acute forms can be caused by bacteria treated with antibiotics, but if they last for a long period of time, the three that you're going to be responsible for are osteoarthritis, rheumatoid arthritis, or gouty arthritis. And gouty arthritis is also referred to as gout. And the bursitis also could happen in a tendon sheath as well. Because remember, both the bursa and the tendon sheath are sacs of synovial fluid. The tendonitis, however, this would be inflammation of a tendon. The tendon is what's going to anchor the muscle to another muscle, and a ligament is the tendon is going to anchor the muscle to the bone. The next three slides then are going to be on these types of arthritises. So osteoarthritis is the most common. It's irreversible, degenerative condition. Unfortunately, it's a sign of aging that we all have at some point, and it may reflect excessive release of enzymes that break down articular cartilage. The cartilage is broken down faster than it is repaired. Some situations there are what are called osteophytes, which are bone spurs that may form thickened ends of bone. Some people have to have those surgically removed. But by the age of 85, half Americans at least develop osteoarthritis. Osteoarthritis is usually part of the normal aging process, as I mentioned. Joints become stiff. Weather definitely can affect them, can make a crunching noise, especially when rising. So if we look a little closer here at this image with the x-ray, we can see an osteophyte here. You can see hyperextension of the first metacarpophalangeal joint. There's a squaring of the thumb here that you'll notice. A deformity here, and a bony enlargement at the knuckle. And you can see lots of those on the x-ray as well. The next type of arthritis is much more crippling. It's called rheumatoid arthritis. This is usually treated with a rheumatologist. You can see this hand is just super, super crippled. It's a chronic, so it lasts a long time. It's not acute. And it's an autoimmune disease of an unknown cause. So the immune system attacks its own cells. That's what the word autoimmune means. And you'll learn a lot more about that in A&P2. But it usually arises between age 40 and 50, more common in women than men. Signs and symptoms include joint pain, swelling, anemia, so that means a low amount of red blood cells, osteoporosis, muscle weakness, and unfortunately some cardiovascular problems. But the rheumatoid arthritis begins with inflammation of the synovial membranes, which is sinusitis. The last type of arthritis you're responsible for is gouty arthritis. And this is the deposition of uric acid crystals in joints. And this is a lot of times from proteins or other nutrients that contain nitrogen. So these crystals are going to deposit in joints and soft tissues, followed by inflammation. And they're typically found at the great toe, the large toe. And if untreated, the gouty arthritis could lead to bone ends fusing and immobilization of that joint. So there's drugs, plenty of water helps, avoidance of alcohol, foods high in purines, and purines are a chemical found, they're nucleic acid, but most importantly, they have nitrogen. And it's important to not take things that affect the liver negatively, kidneys or sardines. And kidneys are the main way that the body removes waste products and puts them into the urine. The last homeostatic disorder is Lyme disease. Lyme disease is also an autoimmune disorder. It could be caused by a tick. So a bacteria transmitted by a tick bite. Hopefully they catch it right away, can treat it with a long course of antibiotics. But unfortunately, when it does linger, it can attack even the nervous system. Symptoms initially are skin rash, flu-like symptoms, foggy thinking, but it may lead to joint pain and arthritis. And I've seen it just cripple people. So I have a friend who's maybe in her 40s, looks like she's in her 60s at least, and she has to use a walker because she's had Lyme disease, and she's had it so long that it's crippled her nervous system. So Lyme disease can be especially terrifying.